This portion of the video will be going over patients' notes and EHR narratives and how to complete them. The first thing you should do is enter the patient's chief complaint, which should include any symptoms the patient has been experiencing from the tooth, and any significant details about the history of the tooth, including recent dental work. You should also confirm that the provider is correct and it has a case type, like a root canal, retreatment, or surgery. You can also enter in patients' vitals, such as blood pressure, in the boxes here. To open your clinical testing chart, you'll press New. For some reason, the screen recording did not record this, but a tooth chart will pop up after you've pressed New, and you just have to select the teeth that your doctor will be testing. The teeth that you selected will show up in this clinical testing chart, and you can fill in any symptoms the patient is experiencing during the clinical tests. Most of the boxes do have multiple options that you can choose from. To see these, all you have to do is click on the box and you'll see the multiple options. If you press on the red X's on the left-hand side, it will automatically fill the testing boxes with WNL, which just means within normal limits. This basically means asymptomatic. Then you'll click DX at the top of the menu bar here. DX stands for diagnosis. You'll have 3 diagnoses. One is for the pulp, one is for periapical, and one is for periapical as seen in radiographs. Then you'll enter in a prognosis for treatment and a treatment type. Then you'll press TX, which stands for treatment, and this chart will pop up. At the top, you can select a treatment that we gave the patient today. On the right, you can select all the options that apply to the patient's treatment for that appointment. At the bottom, there is an option to enter any anesthetics that were used, if any were used, and you will also enter how they were administered. In the chart below treatment, you will record all the lengths and sizes of the canals in the tooth. On the right-hand side of this chart, there are extra spaces for notes to include about any of the canals, such as a post being present, the canal is calcified, or the canal joins with another canal. To enter in your DEXIS images, you'll select Template. You'll then select New. The screen recording does not show the window that will pop up after you press New, but all you have to do is select Endodontic Basic if the patient is being treated, or consultation if we are not treating the patient and they have just had a consultation. Then just confirm that the tooth number is correct. The screen recording also failed to record the DEXIS window, but all you have to do to copy an image from the DEXIS is go to the far left-hand side and press DEXIS, and that window will pop up, and then you double-click the image that you'd like to copy. That will blow up, and then you'll press Ctrl-C on the keyboard, and then you'll go back to this page, and you'll press the Paste button on the menu bar. The first image is the initial image that you take at the patient's consultation. The second image should be the completed treatment image. The third image is going to be the patient's x-ray when they come back for their recall appointment. To write the narrative, you'll go to the upper left-hand side and press EHR Narratives. Then you'll press New to create a new note. Different template options will pop up and you just have to select which one you need and then press Choose. The template format will fill the page and then you press Power Merge on the left-hand side and it will autofill the patient's information that you previously entered into their chart into the note. This includes health history, vitals, clinical testing results, treatment for the day, lengths and sizes of canals, and radiographs. The only other information you do have to enter into the note will be at the very end above the radiographs. You'll enter in the treatment the patient received for the day and also what their next visit will be. You should also write down any information that is not already included in the patient's chart. Some examples might be if the patient had nitrous for their treatment or oral sedation. It's also good to include any information that might be helpful to the next assistant who's seeing the patient. To make a CBCT note, you'll go to EHR Narratives, and the template you'll choose is the CBCT consent. You'll press Choose. Then you'll power merge the patient's information into the note. Then you'll have to go in and manually enter in the location you're at, the tooth number you're looking at, and the assistant. Then you'll transcribe the notes that the doctor has written on the hard copy of the CBCT form. The referral report is completed by the front desk. You'll make a new document, and the template you'll select will be referral report for whatever treatment that the patient received. And you'll press Choose. And then you'll power merge the patient's information just like the other notes. The DEXIS images will also load into the document, so it is important for the dental assistants to make sure to get the radiographs from treatment into the patient's notes so that they can be power merged into this report. On the lower left-hand side of the note, you'll check off any treatment that applies. And then on the right-hand side, you'll click the highlighted portion. You have to click a very specific part of it, so just keep clicking until it pops up. And then you'll select the treatment the patient received and it will merge into the document. You will see patients who need treatment on multiple teeth, but the notes only merge one set of radiographs for one tooth. So this is how you add another tooth to the patient's chart and the radiographs to the EHR narrative. You'll first have to make sure that 2 teeth or multiple teeth, however many there are selected in the clinical testing for treatment. Otherwise, they won't show up in the patient's chart. Then you'll go to Templates. Then you'll make a new file for another set of radiographs for a different tooth. Then you'll just copy and paste the images for the second tooth, just like you did the first tooth. Then you'll go to EHR Narratives, and you'll open the narrative that you'd like to edit and add DEXIS images to. Then you'll go to the radiograph section of the note, and you'll click and leave the cursor where you want the images to load. On the lower right-hand corner, you'll press Images, and then from there there's a drop-down menu, and at the bottom you'll select Images Insertable Table. Another window that you can't see in the screen recording will pop up, and it will let you select the radiographic images that you would like to merge into the document. Then just press Power Merge again, and it will merge the other two images into the document.